Good morning. I feel like a lucky girl this morning. Anyway, all right, on to the Laconis. You're starting to see more and more men come through your doors.
We are. We have maybe 3 or 4 new men coming in per day.
And do they come in saying, hey, I was kind of wanting a little something, something, or are they like brash and bold about it?
Well, they're coming in, their crow's feet are starting to bother them, or they're competing in jobs, they're competing for younger women, and so a lot of them come in for Botox or just basic skincare, like to get that youthful look. We exfoliate, you know, we do basic exfoliation, microdermabrasions, light chemical pills, but a lot of Botox.
What took men so long to get with the program?
Well, you know, I guess men have been a little bit behind in this area, but I think there's a new emphasis on being vital, being young, and staying in the game.
Yeah.
For men, a lot of things might be something to do with the workplace as much as social.
Yeah.
You know, they want to look young.
You mentioned social, and I have to bring up here Steve.
Yes.
You're like doing the dating thing.
Well, yes. Yeah, I sure am. It's also just part of overall health.
Yeah.
You know, just the skincare is just part of exercising and staying healthy and feeling good about yourself.
Yeah, but getting a little something done, you say it kind of widens the range of the women you can date. What do you mean by that?
Well, yeah, sure. You know, I mean, when I turned 80.
Yeah.
Going to want to look better and then, you know, date women half my age, so you do what you got to do.
You do what you got to do. What did you do?
Well, I've been going to the Laconis for a while now, and I've gotten the dermabrasion, some of the Restylane. I've tried the Botox and a few other things.
Yeah.
And a lot of skincare products and things that they have.
Yeah, and don't mind admitting it now.
No, it doesn't bother me.
Okay.
What's funny is that Steve didn't want to go to his reunion this year because everybody looks so old.
That's what he said. And they're all looking at you going, wow.
It's depressing.
And Juan, for you, you said, look, you turned a corner and you said, enough already. You had gained a lot of weight over the years, and you're like, okay, I've had it. What was the point for you where you said, I'm doing something?
Well, I started crossing my feet to tie my shoes.
Yeah,
and
one of these
I
numbers
said,
here where you're
you know,
like,
that's enough. I went to see Richard and got on some of the male hormones and then started, you know, losing weight. The muscles start tightening up. Then I went to my 30th high school reunion, and those men looked like my fathers.
ooh.
And so I figured, no, it's time to do something, and I'm in the business. You know, I'm in the beauty business, so you have to look good.
Yeah. So what did you do?
Oh, I've done everything. A little microdermabrasion and basically just Botox and keeping it up. And I started with the male hormone treatments, and that is amazing how that works.
Yeah, and we'll talk more about that in just a little bit. Chris, I'm looking at you. There's no problems here. You are only, of course, there's no problems because you're only 28. But have you thought about getting stuff done, or have you actually had some things done?
I've actually had a couple of things done, and to be honest with you, I just started about 3 or 4 months ago.
Okay.
Before that, I was always really hard on my skin, and a friend of mine mentioned to me, a girl actually, she said, you know, why don't you start taking care of your skin? And I started noticing some lines, you know, as we talked about it, and I said, you know what, I'll go ahead and visit with Laconis, and from that point on, it's kind of addictive.
Were you one of those guys that you're like using the Dial soap, and you're like, oh,
yeah,
wash my face with it too, wash my hair with it too, yeah, wash everything with it, yeah, just whatever you had.
Right.
Yeah, you know, liquid palm olive, whatever, wash the dishes, wash my face, wash my hair, a whole bit. All right, what about for you?
Well, me, it's just, you know, self-esteem and just, you know, just looking good for myself first.
Yeah.
And everything else after that, just gonna keep living.
Yeah.
Yeah.
Okay, so we talked about some of the procedures, and we have some before and after pictures just so people get an idea of what it is. So let's put up one of the pictures here. This is a before and after. Is this in that nasal labial area?
Yes, and this is actually Richard.
Oh, look at Richard, look at you. So you have the advantage. You can just do this all the time.
right
You
there.
probably have it at home.
No,
don't
I'm
you?
holding it
Next
down.
morning?
It's like the plumber's pipes are never fixed.
Yeah, exactly. Yeah.
But no, we filled his folds in and gave him, restored some lip volume. His lips had, as we age, we lose volume in our lips, and that really bothered him. So a little filler, if there was absolutely no downtime, and that was immediately after.
Yeah, and you say filler, what kind of filler are we talking about?
We used Restylane.
Okay, and how long does that generally last?
It lasts around 6 to 9 months, where like 2 of these guys, like Steve and Chris, I did some fillers under their eyes because they had like some dark circles. Again, that's Restylane that we put under the eyes. And in both of them, we put some in their smile lines as well. So that's a big problem for men.
Yeah.
That what bothers them is that they have that tired look and the deep nasolabial fold.
I think for women too. And we associate that with age, but sometimes it's just genetically how you're made.
Right.
Absolutely.
Okay, let's take a look at some other pictures and see some differences here. All right, yeah, the frown lines in the forehead.
Yeah, that's Botox.
Okay.
And that's what bothers a lot of men too, because they want to be more approachable, or they want to have that softer, you know, softer looks. And the lines, as we age, they just get deeper and kind of give you that angry look. So
yeah, you're right. And kids will tell you, because my son did walk up to a man the other day and he said, "Why are you so mad?"
Yeah.
And it was like, he went, "Honey, if you notice, he is smiling." He goes, "But look at his forehead." So he'll probably be calling you soon. But the Botox, and again, there's been some question about Botox that people have had. So can you clarify some of those issues for us?
Well, you know, Botox is probably one of the safest cosmetic treatments that we have. It's been administered to millions and millions of people now for years. One of the few things you heard about the incidents in Florida were actually not Botox. They were not Botox. They were something completely different. So, but unfortunately, it was somehow, you know, connected with Botox.
And what Botox can do, obviously, is stop you from making that kind of frown. And have you've had the Botox one?
Yes.
Okay, so how does it feel? Because that's a question a lot of people ask is, well, how does it feel?
Well, it really doesn't feel any different, except that when you look at yourself, you don't see those obvious lines, and your skin feels tighter.
Yeah.
You know, so you don't feel like you're.
Try to give me a frown.
Well,
yeah. Okay, so you got you leave a little bit.
I got a little
there.
bit. I don't want to be like.
Yeah. Well, I tried it a couple of years ago, and I had it like right here, where you can see that I can frown now. I gotta get that fixed. Anyway, it was funny because I was trying to be stern with my son, and he's just staring at me laughing. And I'm like, "I told you right now, you stop that now. I am mad now. Stop that now." So he didn't know. But you still leave room for expression, because a lot of times people think they're going to get that look where you're just kind of staring into space and can't have any expression. But you leave that.
And well, we have a lot of men that come in, they don't want to look Botox, and they tell me, "I don't want to look Botox. I don't want to look like I had anything done." So we are able to adjust the dose so that it leaves them with just a softer, more refreshed look.
Still express a little bit, you know.
Yeah.
It's not going to leave you.
But the other remarkable thing is a lot of men come in, especially like accountants, attorneys, they have tension headaches from stress or from just studying or reading, and that helps soften that too. It really takes away, you know, headaches.
Right. Botox can be used for other things besides just aesthetics. Okay, do we have some other pictures that we want to look at? Okay, no more pictures there? All right, so you first got it done. Did you rush to the mirror? You did.
Well, they had one in the office.
Yeah. And so how did it make you feel?
Well, you know, it was, you're automatically going to, if you look better, you're going to feel better about yourself. So it was just an automatic. You know, you're going to, and I didn't have any of the numbness or whatever they're talking about. You know, I had one show on TV where they came by and put a sign on the guy's head and you didn't know it.
Yeah.
So I didn't have any problems with that. Yeah, I didn't feel any numbness or anything like that. It's like I was saying.
How the ladies respond to it?
Well, you know, that's it.
Is there more than one? Is that why you're hesitating? All right. And Paul, how did it make you feel? And is this something that you'll keep up for the rest of your life?
We'll see. I don't know.
Well, he hasn't started yet. He's
really?
coming in complaining about
I
his
see.
crow's feet, so he's just now starting to feel the effects.
Okay. So wait, he already you had it or you didn't have it yet?
He's going to.
Oh, okay. So any
Big
questions? Yeah. Any questions you want to ask these guys who've already done it?
Recovery time.
There's actually none. And the thing you don't have to worry about, Dana, I went to someone else before her, and a little too much made me look like Spock.
Yeah.
And Dana has a really neat technique of doing that where she doesn't allow that to happen. So it's virtually nothing. There's no pain whatsoever.
Yeah.
What I like is as the days increases, it takes like 10 days to really take effect. You start going,
You start looking better and better.
and it starts molding into place. And then, well, the last time she did it, she really structured my face different. So when the 10 days were over, I was like, oh my goodness, I look good.
All right. What about bruising? Because this is something you want everybody to know. The bruising and things like